Hi, everyone. Welcome to Sharecare's Caregiver Stress panel. I'm Dan Weinreib, Vice President of Strategy at CareLinks, a Sharecare company. For those of you who don't know, CareLinks is the largest network of tech-enabled caregivers in the US, helping families across the country find the perfect caregiver to become a part of their family and offer support in the comfort of their own homes. And that's exactly why we're here today. We are in a caregiving crisis, especially our family caregivers that are taking care of loved ones and feeling all of that stress and anxiety that comes along with that job. Joining us today are experts who can speak to caregiving and the mental health aspects of becoming a family caregiver. First, we have Jennifer Olsen, PhD and Chief Executive Officer, and I'll allow Jennifer to introduce herself.
Hi, Dan, thank you. I'm Jennifer Olsen, CEO of the Rosalind Carter Institute for Caregivers.
Thanks, Dr. Olsen. Next, we have Michelle Dupuy-Lara, a family caregiver herself, and I'll allow Michelle to introduce herself.
Hi, everyone. So I am a caregiver for my husband currently. He is a wounded warrior. He does have some combat-related injuries and dementia. I've also formerly had cared for my mother. I am also a full-time student at the University of Texas, majoring in biology and biomedicine.
Thanks, Michelle. Appreciate you being here today. And finally, we have Dr. Judd Brewer. Dr. Brewer?
Hi, everyone. I'm Judd Brewer. I'm an addiction psychiatrist and a neuroscientist. I'm the Executive Medical Director of Behavioral Health at Sharecare.
Great. Thanks, everybody. So let's start the panel discussion. Rosalind Carter once said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and then finally, those who will need caregivers. Dr. Olsen, you're the Chief Executive Officer of the Rosalind Carter Institute for Caregivers. I'd love to hear from you how you define a caregiver.
Thank you. That quote that Mrs. Carter created nearly 30 some years ago still applies to caregivers today. We see caregivers in every sector and in every setting. We consider caregivers the invisible front line of our healthcare system, often standing beside or sitting beside the patients in a variety of settings. And part of our work has shown us that caregivers' experiences can be variable. They can sometimes do work like chores or housework and yard work. Sometimes it can be medication management, or moving people, bathing their loved ones, and it can continue on to complex care management and dealing with legal, financial, and insurance challenges. Our friends at AARP and the National Alliance for Caregiving have indicated that there are 53 million of these individuals pre-COVID, so we can only assume that the number is greater now. So that's 1 in 5 adults caring for someone else in this country. And that could be a friend, a family member, chosen or biological family, or a neighbor in their community. So caregivers are everywhere.
Thank you, Dr. Olsen. You mentioned the pandemic, you mentioned COVID. So I have a follow-up question to your comments. Given the pandemic, how do you feel that has impacted caregivers in the US? And also, what do you think the state of caregivers is today in the US?
So I think caregivers before the pandemic experienced challenges with their physical and mental health as compared to their non-caregiving peers. Some work out of CDC this summer, though, showed that amongst caregivers, their experiences with anxiety, depression, suicidal ideation, and trauma were all at increased rates as compared to those who weren't caregiving. And the community that is experiencing the impacts the greatest are what we call the sandwich generation, or maybe the smush generation, those who are both caring for an older adult or a family member and have young children at home. They were experiencing these mental health challenges at 5 times the rate of non-caregiving peers. And so when we use the word crisis, I don't think we use it lightly. I think that's truly what we're in.
That's very insightful. Thank you. Thank you very much. Michelle, I'd like to turn it to you. I'm very interested to hear, do those words ring true for you? If you could take us through a day in the life of being a family caregiver to your husband, and let us know exactly what your anxieties are and what your stresses are. That would be helpful.
Absolutely. I do believe that we are in a crisis with caregivers, and it is extremely challenging. My daily life basically looks like trying to ensure my husband's safety because of his dementia. He's had basically in the past suicidal attempts. And it's more of the safety. It's also taking care of the finances, taking care of the vehicle, taking care of the house, taking care of his basically diet needs because of his health care. Also, while I'm doing that, to try not to lose myself in the process, which is extremely difficult and sometimes very challenging.
Michelle, you mentioned some of the things that are so challenging for you. I also want to call attention to some of the things that you find to be so rewarding about what you're doing today and how you're supporting your husband. Can you shed a little light on that for us too?
It is rewarding in the point that I am capable of being able to take care of him, and that I do not have to put him somewhere in a home, an institute or anything. So I'm happy that I'm able to do that for him, and that he's home. He is with family. He has the love and support around him, and he's able to still see us daily. And when I say us, I mean myself and our daughter. So that is something that's extremely important.
How has this impacted your daughter?
Whew. So she's very young. She's in college right now. She is hopefully about to graduate soon. It is challenging. It's very challenging. She's experienced her own loss, which was my mother, and she was the one that raised her. So having her dad basically be in this type of situation, and knowing she does know all of his healthcare needs, and the situations that has happened in the past with the suicide and everything, it's been challenging, very, very challenging and traumatic for her.
Yeah, I can imagine. We lost my father last year, and I watched my mother go through all of that, and especially during the pandemic. And we were all family caregivers at that point, trying to help out. But it's clear that it does take a toll on everyone in the family, not only physically and but also emotionally and mentally. And I'll turn that next part over to Dr. Brewer. Dr. Brewer, you've spent decades studying anxiety. It would be helpful for us to kind of hear your perspective and talk a little bit on how anxiety forms in the brain and why caregivers may experience a heightened sense of anxiety given their situation.
Yeah, it's a really important question, and the way that that we've summarized a lot of the research that my lab and many labs have done is that anxiety can actually get formed almost as a habit, where we can have these feelings of anxiety that can trigger worry thinking as a mental behavior, and that mental behavior of worrying makes us feel like we're in control, or at least we're doing something when we may not have control over a situation. And that all builds from our brains not liking uncertainty. We've seen lots of uncertainty over the last year or so, and this isn't just pandemic related. There's uncertainty that happens all the time, and I think this can be especially true in caregivers, where they're not sure what the future is going to look like. There can be a lot of issues around just day to day. Are things going to go this way? Are things going to go this way? Are things going to go this way? And so the worry thinking, which is just our poor survival brain trying to help us think into the future, it can start to spin out into these worry habit loops, where the worrying actually gets in the way of our thinking and planning. So where it's really important to be able to think and plan, especially in planning the day for the folks who are caregiving for, the when that spins out into worry, it's harder for our brain to do that thinking and planning because our prefrontal cortex goes offline.
That's very helpful. I think it's also very difficult to be able to find that focus when you're experiencing all of that stress and anxiety. And Michelle, as a caregiver, how do you typically manage your own stress and manage anxiety?
Sometimes it's very difficult, where basically I have to put my needs aside for the moment and take care of what I need to. And there isn't time to basically take care of my stress and my anxieties. But when I'm able to, I would step out of the house and just try to take a deep breath, try to enjoy some of the nature. For me, nature is very therapeutic. Also, anything of art that I can do at home, it would be wonderful. And it does help a lot.
I'm glad you've been able to find those outlets. On the converse side of that, have there been some bad habits that have been unavoidable for you that you've kind of fallen into because of the situation?
Yes, I would fall into the isolation, which is the biggest thing that caregivers do fall into, is more of isolation. And also the depression, where sometimes I just don't want to get out of bed. I just want to be in bed and do nothing but sleep. Unfortunately, that's something I don't have the luxury of doing all the time. But yes, that is something that I do often find myself falling into. The other issue that I used to have was nicotine, which I'm glad that I don't smoke anymore. But it was something that was a horrible addiction to get into. And that was something that I did fall into.
Well, congratulations for stopping smoking. That's a big achievement. You should be very proud of that. I know that's not easy. So congratulations there.
Thank you.
Yeah. Dr. Olsen, the Rosalind Carter Institute for Caregivers has worked with Sharecare to co-develop a mini course on caregiver stress that's available in the Unwinding app by Sharecare. What does the mini course cover, and what do you think the purpose of the courses are?
Course is tailor-made for caregivers. I think there are many experiences and emotions that caregivers face. And as Michelle said, they may feel isolated in those experiences, or that they're the only caregiver going through challenges of isolation, guilt, exhaustion, grief, and just kind of sheerly being overwhelmed by the magnitude of the responsibility. We kind of go from having a person who's responsible for themselves to sometimes being fully and totally responsible for others in their family, often in an unexpected way, a phone call that changes a life. And so I think what the app is doing is recognizing that caregiver experience may be different, and that there are ways that kind of tools or approaches can be packaged to best align with where a caregiver is and how they're viewing the world. So this is kind of, I'd say, especially made for this caregiver community.
Knowing how little the resources and support are for family caregivers out there, how important do you think it is for our two companies and organizations to partner on a resource like this?
I think it's important for a few reasons. The first is, during COVID and maybe into the future, there's a reduction in availability of various respite sources or outreach for people. If they were traditionally having large family groups over, that couldn't happen during COVID. Senior centers or adult day centers may not have been open, and they may or may not reopen at the same rate. And so finding ways to reach caregivers that can happen from the hand of your phone is critical. I think the other aspect, though, is to think about what we heard from Michelle, and we hear from caregivers all the time, is the most precious resource they have is time. And so we want to kind of continue to look for ways to give really bite-sized, useful content to caregivers, rather than expect a multi-hour course or training where the person has to find somebody to care for their loved one so that they could come to, a 4-hour program or experience. A minute a day or 5 minutes a day, if that's what's available, we want to have something that is ready and easy to access for someone.
That's great. Thank you. Dr. Brewer, you've been instrumental in building this and partnering. Tell us a little bit about how you would provide advice to a caregiver that might fall into some unhealthy habits.
Well, just like Dr. Olsen was saying, starting with thinking through what's the best way to deliver information so people can get it at times when they're ready for it. So my lab has been studying, how best to change habits and develop new habits, and have found that digital therapeutics, fancy term for apps, is a good way to do that. And that's why it's one reason we're really excited about this partnership where we can have this caregiver course, because we can deliver these bite-sized pieces. And so, the advice that I would give is the similar type of work that we've done in helping people quit smoking, or helping people stop overeating or stress eating, and even, helping people with really severe anxiety. And that all builds on how our brain works, and so if we can understand how our minds work, that's how we can start to work with our minds. So the advice I would start with is, just kind of mapping out where it is that we get in our own way. There are certain things that we don't have control over that get in our way. And, because we don't have control, that's not the place I recommend people starting. But I look to see, where is it that there might be that their brain is trying to help them out, but it's kind of getting them off track. And a simple way to start there, and I think Michelle spoke to some of these, is that, checking to see if we fall into habits where we're trying to help ourselves, and so with stress, our brain says, hey, that's uncomfortable, make that go away. And so often we'll turn to things like social media, we'll go out for a smoke, we'll, go walk into the kitchen looking for something, even though we're not really hungry, or we might just, worry, or there are, many things that we can do as a way to have a coping strategy when we don't know how our mind works. And so the first place to start is to just kind of map out that process. What is it that triggered me to do this behavior, whether it's worrying, procrastinating, overeating, or whatever. Check that, whatever that behavior is, and then also map the third element, which is what's the result of this behavior. That trigger behavior result relationship actually feeds back and drives any type of unhealthy habit that can actually get in the way of caregivers caring for themselves, because it kind of takes them out of being optimal for, to be there for their loved ones.
That's very helpful. Thank you. I think one of the things that's critical in this process that a lot of people struggle with as well, especially the caregivers, is asking for help, right? So you've mentioned resources, you've mentioned the app, and I'd love to hear from Michelle if you have found it difficult to ask for help.
Yes, I have found it difficult. Many of the times it's more of the mentality that a caregiver may have of, well, if people do not see the person that you're caregiving for, they don't see maybe any physical disabilities, they automatically assume, well, they can take care of themselves. So I don't understand why you're taking care of them, why you sound like it's so difficult. And so having that stigma of, okay, my husband does not look that way, people are going to automatically assume I'm wasting my time. So why should I go and ask for help? Like, I feel like I don't deserve to ask for help sometimes. And it is very difficult.
So those people that are responding to you in that way, obviously are not going to be all that helpful, but have you been able to find a go-to person that you can talk to, that you can ask for help?
Honestly, it's just been most recently our daughter, because now she is an adult and she's able to take on a little bit more responsibility. And she does realize that maybe in the future she will have to take care of him, because we don't know what can happen to me. We don't know what can happen in the future. So I've tried to prepare her in that sense. And it is something that she's become responsible for it. And she's been helpful.
I'm glad she's open to that. It's never easy to watch a parent need help and she's lucky to have you, and you're lucky to have her. You guys can be a good team, it sounds like.
Thank you.
Yeah. Dr. Olsen, the Rosalind Carter Institute for Caregivers specializes in supporting caregivers throughout this journey. What is the number one piece of advice you'd give a caregiver for managing stress?
We often talk about caregivers are so committed to caring for the person that they're focused on. And we ask them, how can you care for someone when you're giving them the rest of you and not the best of you? And so it sounds kind of corny in some ways, but I think a lot about, so in order to be that best caregiver you can be, you're going to have to find the practice or the approach that helps you deal with stress. We can't prescribe what that is. It can vary for people. Obviously, nature, breathing exercise, finding a new recipe and trying that out, even though no one in the house might eat it. Whatever that activity is, finding that and making a commitment to yourself to do it, and realizing that that's the best commitment you can make to your care recipient, to do that activity as needed or probably more than you need it.
Yeah, that sounds like great advice. And we talk about in situations like this, and even Michelle just mentioned it, finding additional support, right, and kind of creating your own care team.
Mm-hmm.
Can you talk to us a little bit about what the concept of care team is?
For us, that's the idea that there are going to be people who you are connected to who might be willing to do certain activities in your care journey. And that there are people who will say to you, and I would imagine Michelle can count the number of people who have said at some point, well, let me know what I can do to help. And sometimes that person is truly genuine, and other times they might just be thinking that's what I'm supposed to say in this situation. But what we found is if you can have a kind of list of, these are the things I need somebody to do, take the trash cans out, or make the grocery run, or come over on Tuesdays to watch a sporting event, and hand that list to somebody, literally or figuratively, and get them to connect on one or two of those activities, that'll help you build out that team of people who can do some of the elements of your responsibilities. Because while it may seem like they are all on you, there are people that will take on some of those things, maybe because they enjoy them themselves and don't see that as too big of a burden, or maybe they truly, when they say, let me know, are just looking for those ways. It takes time, though, to learn to be assertive with those asks. So we have been, and I think in parts of the app, you'll see kind of getting into that skill of not just saying, I got this, but saying, actually, there's a list on the fridge.
That's extremely helpful. And I think making those lists and using the app and understanding what you can do to be more assertive, right? And even Michelle mentioned it earlier, that it's difficult to ask for help. You want to handle everything on your own, and you don't want people to think that you're not deserving of it. And at the same time, those people that want to help, they need some direction too. So that's great advice. Dr. Brewer, in your opinion, what do you think gets in the way of caregivers asking people for help?
Well, I think there are a number of things that get in the way, but some of the top ones that I see are just this, feeling like they're going to be a burden on other people, which we can see some of the irony in that, where they're caring for someone, yet they don't want to overburden other people in asking for help. And so there can be some hesitancy to ask for help there. I see a lot of self-judgment in terms of where people kind of blame themselves for not being able to do more, or feeling like they should be doing more. And so a lot of these shoulding things, these can even become habitual in the mind, where we're judging ourselves or thinking we should be doing more or whatnot. That can actually get in the way of actually reaching out for help as well. So those are two of the big ones that I see.
Can you go into a little bit about how the behavior change framework can be used not only to break those unwanted habits, but also build new healthy habits?
Yeah, I'd be happy to. So here, what we've really focused on is the neuroscience around how habits form and how we can actually target that process in helping people break them. And it turns out to be relatively simple, not necessarily easy, but simple. And the simple process happens because we form a habit when a behavior is rewarding in some way. And that could be rewarding long time ago, and we're not even aware of the reward now. And the only way to break a bad habit is to pay attention now and really feel into our experience and ask ourselves, what am I getting from this? How rewarding is this right now? So we can update the reward value. A very simple example would be if I like chocolate cake and I go into a new bakery and I try their chocolate cake, it could be the most delicious chocolate cake I've ever had. So my brain's gonna learn, oh, this is a good bakery. You should go back here and eat some more cake, come back again. But if I eat the cake from that bakery and it's not that great, my brain also learns, you can avoid this bakery in the future. And so we can see from that simple example that, if we're not paying attention and somebody says, hey, how's that new bakery? And we say, oh, it was on my phone. I don't remember. So we haven't actually learned anything. But if we pay attention, cake's great. We learn, oh, do that again. If we pay attention, the cake's not very good. We learn, oh, don't do that again. And that principle is true for any habit. So if somebody is struggling with quitting smoking, I see this a lot in my clinic, what I have them do is pay attention as they smoke. And they can start to see that, no patient has come back and said, wow, these cigarettes taste so great. Thank you. Now I smoke more. No, they start to say, wow, I never noticed how crappy this is. And they start to become disenchanted with the behavior. The same is true for beating ourselves up, for judging ourselves, for worrying, all of these habits that can be true when we're caregiving. And so if we can really just pay attention to what the result of that behavior is, just simply by asking ourselves, what am I getting from this? That can help us start to become disenchanted with the behavior itself. Once we become disenchanted, so that's how we can start to break some of these unhealthy habits. And then that opens the space for what I call the bigger, better offer. And that's where we can start to notice using the same process, we can ask ourselves, when I ask for help, how does that feel? Often the people that we ask for help from are very, they feel great that they can help out because they see the caregiver struggling. And so, and the caregiver feeling, having a little bit of help, it feels great there too. So if they just pay attention to how rewarding it is, just for example, to ask for help, they get the benefit of saying, oh yeah, wow, many hands make lighter work. And then the person that's helped them out also gets the benefit of providing generosity in helping as well. And so that process, that paying attention to the results of the behavior, if it's an unhealthy one, seeing how unhelpful it is and feeling into that, oh, this really doesn't feel very good. And also feeling into what it feels like to do something that's healthy, whether it's going out into nature, taking a walk, asking for help or whatever, that helps change that process in our brains. So we're more likely to do the ones that are more healthy and also to let go of the ones that are unhealthy. And in a way that doesn't require us to force ourselves. Oh, I shouldn't do this. That tends not to work. But if we just bring our awareness in, we can let that awareness do the work for us.
If I may interrupt, and I'm sorry if I do, if I can just give you a little example of an experience. So before, I really had a difficult time asking for help, but one experience that unfortunately I did have in 2019, I had 2 emergency surgeries. And I really had no one to help me at all. So those emergency surgeries, I had to stay in the hospital. It was pretty bad, to the point where the doctors told me, if you did not come in at the time that you did, you would not be here today. And that really lit that light bulb in my head of, I really need to start asking for help and push aside maybe the thoughts and the guilt and, feeling bad of trying to ask for anybody's help or putting that burden on anyone.
Well, thank you for articulating that. I think that's a great example of how, and can I ask you, How does it feel now when you ask for help, when you remember that situation?
It feels a whole lot better. It's still taking time for me to be able to get used to it, but yes, it feels so much better.
Yeah. So I think that's a great example of building that healthy habit through that awareness. Oh, this is helpful. So thank you for sharing that story.
Thank you, Michelle. And don't wait for another event to ask for help, please. All right, we want you healthy. Dr. Olsen, we heard a staggering statistic the other day that 1 in 5 full-time workers are caregivers. And the Rosalind Carter Institute recently published a report titled Working While Caring. What are some steps that employers can actually take to support this workforce that is working full-time, perhaps raising children, and also taking care of someone and serving as a family caregiver?
One of the first things is to learn about the caregivers in your workplace. If you're doing employee surveys or even in the open enrollment process, we know those processes have a lot of questions about all sorts of dynamics. Is there a way you can ask a question about if you're caring for someone so that you can be informed about benefits or things that might be useful? The second is to look at what you already offer, and with the lens of, if I was caring for someone in my family, would this benefit apply to me? Is it really challenging to get access to it? Is it only applicable in certain, if the person lives with me or if it's a certain age or something? How can I look at that a little bit more broadly? One of the things our Working While Caring work showed, which won't be a surprise to Dr. Judd or others, is that emotional stress was the most significant challenge cited by employees as what was really one of the reasons a number of employees felt they had to either reduce their work hours or leave the workforce altogether. And one element of that is that we don't have a workplace culture in most organizations where a manager or a supervisor has any ability to, or knowledge about how to respond when somebody sits down at their desk and says, so I'm caring for someone, or I've have to leave work early because of these reasons. And so that manager or supervisor doesn't know what tools to hand over and doesn't have a preventive, like, all right, let's start setting these things in motion so that you're best set up to be a caregiver. You know, how many CEOs are telling their caregiver story? How can we change some of that dynamic so that I think of the way I think of caregivers is expanded, which is caregivers would make great employees. They're amazing multitaskers and have a project management skill set for dealing with all those medications, doctor's appointments, and insurance forms. Their empathy skills are through the roof. So why wouldn't you want them on your team? And as Mrs. Carter's quote says, we're all going to be one of them. So wouldn't you want to have some on your team or who have been through the experience to help others? I mean, I think there's just a transformative nature when we think of caregiver as a positive rather than, oh, this is going to be an employee that's going to have issues with performance or attendance or one of these things. So it's as much about culture as it is about structure.
I love that idea of hearing from the CEO in that scenario as well. And a lot of times that culture does start at the top, and you have to create that environment to be able to be open and share about that as well. So that's really great feedback and insight. Before we close out the event, I want to talk a little bit about some of the questions that CareLinks and our organization always gets. And we talk about that sandwich, or as you referred to it, Dr. Olsen, as the smush generation. These people that are stuck in the middle and their parents might not need the help right now, but they're kind of teetering, right? So they're saying, how can I proactively create a plan, right? How can I be proactive and get ahead of it? And Dr. Olsen, I'd love your thoughts on any advice you could provide to those smushers on planning for the future.
Well, I love this question because I love that people are thinking about the fact that they will likely have this responsibility at some point in their life, and planning ahead and thinking about care responsibilities so that it isn't a place of fear, dreading a phone call or a diagnosis, but rather having those skills or those insights in your back pocket. the best thing that many people can do as they start to think about potential caregiver future is to have conversations with the person or the people that you might be caring for, handling some of those legal, financial, personal choice conversations so that you're not, in addition to doing all the mechanics of caregiving, trying to put yourself in that person's shoes and guess what they would have wanted at each stage here. I think a lot of the challenges that caregivers face have to do with complicated family dynamics and experiences. And a lot of that can be reduced if some of those conversations happen before the hospital admission or before the fall. So take that proactive spirit of thinking about it and turn it into conversations with your parents or the people you're going to be caring for. It's a great New Year's resolution, if I do say so myself. Have that conversation.
Yeah, that's great. And it's something that I'll take to my own life as well. So thank you for that. You know, I have a lot of friends that are very similar, right? Similar positions as I am. And they're knowing that I work for CareLinks, they're asking, you know, things like, what is it? How can I help? Right? I have friends that are going through this as well. I have a friend that is also going through it with her family. And she's asking me, especially because I'm in the industry, you know, what can I do to help and how can I help her? And, you know, Michelle, I'd love to hear from you on this question and how would you respond to my friend who's asking me and asking other friends those questions?
I feel that the best, one of the best things would be even the simplest, even just cooking a meal for that person that one night, maybe once a week, maybe even twice a month, nothing too major. Those little things maybe to them may seem insignificant, but to a caregiver, it saves you so much time and it helps to alleviate some of the stress. Also, just even having to sit with your with the person that you're caregiving for. That's something that they can do, even if it's just for an hour, and the caregiver is able to step out for an hour, even if they're sitting in the car alone and quiet, and just for an hour. It's something extremely helpful.
May I suggest one idea?
Yeah, go ahead, Dr. Olsen. Yeah.
One thing that we encourage people to do is to check on the caregiver that they know and not make that check-in call about the care recipient. So often my mom was caring for my grandmother, and the first thing I would say when I called would be, how's grandma? And having been looking at caregivers and engaging with them, I realized I never really asked my mom how she was or engaged with her as the primary person in the conversation. And so even just a text to just say, how are you? Thinking about you. No need to respond would go a long way, I think, in helping caregivers feel like they're still connected, especially if they're spending a lot of time in their home or in a facility with the care recipient.
And that addresses the isolation that Michelle referred to earlier on in the discussion. Dr. Brewer, do you have anything to add here regarding supporting friends that are dealing with high levels of stress and anxiety? And I would venture to say, maybe don't bake them a chocolate cake, especially if their stress is having them to, you know, overeat. So do you have anything to add on that?
I would just add, just building on what Dr. Olsen was saying, a little bit of kindness goes a long way. So just lending a listening ear or letting somebody know that you are there to support them, even if it's not doing anything, but it's just being. Often this being there and letting people know that we are there for them is the doing.
That's great. Thank you. I think one of the last things here that I want to pose, and maybe Dr. Olsen, you could jump in on this first. As a previous, family caregiver myself, and even just watching, my mom go through it with my father, there was a point in time when it did become too much to handle, right? And we want to feel as though we can do everything and we don't need professional help. But what advice do you suggest, or what might you suggest when a family or a family caregiver realizes that it really is just too much for them to handle and they might need professional caregiving support?
I think there's two things. The first, building off of what Dr. Judd had said, is to find a listening ear to have a conversation with, a non-judgmental space. Because a lot of the conversations around potentially placing a loved one or bringing in different kinds of help bring up guilt and other things. And if you're going to have that conversation with somebody who's going to give you their opinions on the matter, that might not create the best conversation or experience for you. So find that person. Maybe it's someone who's previously had a caregiving experience and is not connected to your family or social life that you can go through that conversation with, and talk through scenarios. The second is to think about are there certain boundaries that you don't want to cross as a caregiver? For some people, it's things like, let's say, bathing a parent or a family member, that is going to be the too much. For other people, it has to do with the ability to leave the person in the home for a day or something, that there are certain moments, and then hold true to those, have the conversations about what those moments are, and bring those to your trusted listening ear, and hold true to those. Back to that, bringing the best of you so that you can be that daughter, sister, father to the person primarily, and a caregiver second.
Thank you for that. We're going to close out here in a second, but I want to hear, if we could, just from Michelle one last time, and maybe you could talk just a little bit more and tell us a little bit about maybe some final words that you might have for people that are in a similar situation.
Well, just like Dr. Olsen, Dr. Bird had mentioned, a little bit of kindness does go a long way. Having just a small text message, and making it just that one moment of the caregiver, about the caregiver, and not about the person they're caregiving for. It does help, because then it just individualizes that person. It reminds that caregiver, you are not alone. You're not just a caregiver. You are a friend. You are a daughter. You are a father, sister. You need to be that person. And just having that support is incredible, and it's wonderful to have as a support.
Thank you, Michelle. And on that note, we can close out the panel for today. And I want to thank all of you for your respective contributions, right? To Michelle, for all of the sacrifice and commitment that you're providing to your husband and to your daughter. And don't be surprised if you get a text message from me asking how you are. And Drs. Brewer and Dr. Olsen, for all of the work that you are doing to support family caregivers, and with the science and with resources, and with the development of the Unwinding app, which we're really excited about. We're excited about the resource that it is going to bring to those that are in these situations, and helping them alleviate that stress and that anxiety. And I guess I'd close it out by saying to all of you, ask yourself, is there something that I can do today to support a caregiver that I know is going through a tough time, and lend that helping hand and offer that kindness. So thank you all for joining today. We appreciate all of your time and all of your hard work and dedication. And to find out more about Sharecare, be sure to explore sharecare.com, and also to find out more about CareLinks and the support we provide to those in the home as well as family caregivers, go to carelinks.com. Thank you so much.
Thank you.